Thank you, Senator Burr and Senator Casey. Thank you for your leadership on this issue. And to our panelists, good morning and thank you for being here. Dr. Inglesby, I wanted to start with a question for you. As we all know, Puerto Rico was recently devastated by Hurricane Maria, and the island is still trying to rebuild from the disaster. The effects of that disaster are obviously widespread. Hospitals in New Hampshire and around the country are dealing with, among other effects, medical product and equipment shortages such as IV saline bags because the storm devastated some of the manufacturers on the island. So, Doctor, what does this shortage say about our overall preparedness in case of a future event or other types of emergencies where medical supplies can't be easily replenished? And what can we do here in Congress with this issue when we reauthorize PAHPA?
Senator Hassan, yes, I agree with you completely that the Puerto Rico hurricane and other storms have revealed how vulnerable our supply systems are. And one possibility to consider would be to consider whether there are some critical supplies, such as saline bags, if they're single-sourced to a part of the world, or some active products or pharmaceuticals, if they're single-sourced, whether or not they should be included in the National Pharmaceutical Stockpile. That is not how the stockpile is configured or resourced now, so it would need to be additional resources for an additional mission. But the stockpile has had great success in acquiring medicines and being able to deliver them to localities, so that would be one possibility if there were an additional purpose and funding for the stockpile.
Senator, can I interject?
Yeah.
The time won't count against you, but Holly Springs is a great example, and the other two facilities that when faced with a pandemic, we actually became visionary.
Yeah.
And we thought, what can we do to meet what we don't know? And we went into a partnership with 3 different companies where we funded 3/4 of the facility of the plant, but with a condition written into it that at any point we could turn it into what's in the nation's best interest. And all 3 owners knew that and participated in it. So it may be a model that we look at as we identify other things, but we have shown a degree of vision in the past.
You know, I think that's very helpful, and I think the example of what happened on Puerto Rico after Maria really helps us focus on one of the next things we should be doing. I also wanted to ask all of you, and I think I'd start the question with you, Dr. Dreisner. I loved what you said about preparedness and response being about people and time, and obviously both demand resources. New Hampshire uses its hospital preparedness funding to support a single statewide healthcare coalition that works to bring together public health and emergency management professionals to assure that the healthcare system preparedness is there across the spectrum of care, from hospitals to home care to long-term care and beyond. New Hampshire, like other states, relies on this funding to help make sure it's prepared for all kinds of emergencies, mass casualty incidents to hurricanes. Unfortunately, like many other states, New Hampshire has seen a significant decrease in hospital preparedness funding in recent years. We don't know when the next emergency will happen or what precisely it's going to entail, so we need to make sure that the coalition in New Hampshire is not only collaborating regularly, but training regularly. Mm-hmm. It's hard to do that, though, when funding is dramatically reduced. So I'll start with you, Dr. Dreisner, but from all of you, do you agree that we need to increase investments in the hospital preparedness program and that it should continue to fund those efforts in all states? Dr. Dreisner.
So thank you for the question, Senator. I would say absolutely yes. If you think about who responds, in my written testimony, I talk about 3 tiers.
Yeah.
We have the professionals, people that do this every day. Yeah. We have people that are highly trained, and they're called upon if there's an actual emergency like one you described, but they typically have different duties on a day-to-day basis. For example, one of our emergency coordinators in Tennessee actually directs our Board of Emergency Medical Services. Right. But when we have an emergency, she's in the State Operations Center. Right. And then we have this 3rd tier, which is kind of everybody else, and the people that you're talking about. They're the public health nurses. They're the clinicians in the hospital. They're hospital nurses. They're people who are called upon whenever there is a need to surge, and their training, and in training and exercising and actually responding, creating the relationships, the know-how. What do I do? Where do I go? Who do I talk to? Those are the critical things. Those are the relationships built on trust that the HPP funding really helps solidify. And unfortunately, when you reduce that funding, that's one of the first things that goes, right? You try to preserve the positions, you try to preserve some of the things you've invested in, but the more fungible assets are the very things you need more of. And I think you spoke to those very eloquently.
Well, thank you. And just in the interest of time, I'll ask the other three panelists anything you would disagree with or add to what Dr. Dreisner just said about the funding.
Well, just the point that it is about people. The earlier question about how do we get the hospitals better prepared, they have to train. And if you don't have trained people, you're responsible not be effective. I mean, that's been shown in many other industries, including healthcare. And with the focus evolving from hospitals to healthcare coalitions, which is actually, I think, an appropriate move, it's not just the hospitals that need to be trained. It's the entire community that needs to be trained. As an emergency physician, can I just do a brief pivot?
Yeah.
After oxygen, the elixir of life in how we care for patients is saline.
Yeah.
So whether you have sepsis because of a high consequence infectious disease, or you've been in an explosion or a bus crash, if you don't have saline, you lose lives. And so there could be nothing more fundamental to our emergency response after oxygen than saline.
Well, I thank you. And Senator, I know I'm over. I'll just submit for Dr. Krog a question about behavioral health needs, especially for children in disasters. The trauma that disasters impose on our kids concern me greatly. And lastly, just thank you for pointing out the importance of focusing on special needs populations. I'm the mother of a special needs young man, and I thank you for raising that in your testimony very much. Thank you, Senator Burr.
Thank you.